So welcome to Canine Wellness Online. Today I want to talk to you a little bit about fascia. So fascia is a very amazing tissue that is in the body, and it covers pretty much, think of fascia as a bathing suit on your body. It pretty much is very tight right underneath the skin, and it covers your entire body, all your bones, your muscles, your organs, everything. So what happens as we age and we do lots of exercise or repetitive strain or you name it, the fascia starts to lose hydration. So I always say it's like one of these sponges. So when it's dry, it's like hard and it doesn't have too much flexibility. But if we wet it, what happens is now, stay tuned for a wet sponge. So now when we look at it, now it's got all this hydration, water, and the sponge now has all this flexibility, it can move. And it's similar to your dog. So what happens is they start to lose some of that water content, and all this, the fascia starts to be like this towel. It's all scrunched up like that. And what fascia does, when I show you how to work on it, is it's basically smoothing out the fascia so that it's nice, and it's actually not like muscle. It doesn't do this. It's all like this. I'll show you a picture, but what we're going to do is actually hydrate that fascia and start to get it moving nicely along with the body and help get rid of some of those restrictions in your body. So how we do myofascial release is if we have our dog lying down. Excuse me, Ben. Hi, Ben. Yeah, we lie down. We lie down. Good boy. Good job. Oh, such a good boy. And basically what you're going to do, put your head down. Put your head down. Is you're going to take your hands, lie down. Lie down. Good boy. Take your hands and never use your fingers. And you're basically going to just, it's kind of like you're making a pie or pizza dough. And basically, oh, it's not a fly, it's a hole in the ceiling. There's been a fly buzzing around here and it's absolutely driving him. It's not a fly, it's a hole in the ceiling. I promise. So basically, I'm going to just take what I've got here. Is you take your hands and you're just going to kind of move the skin. He's convinced that the fly is going to eat him. You're going to take your hands and just move it. And this is your pie. And you can do this anywhere. You can do it anywhere that you feel squishy. If it's hard like this, his knee, you don't really, I mean you can do it there, but it's just not, doesn't have the same effect. And you can just stretch, stretch, stretch. If your dog has an iliopsoas strain, it's really not a fly, I promise. Look. See, look, not a fly. It's a hole in the ceiling. Yeah. But if your dog has an iliopsoas strain, the iliopsoas, ooh, look at that, sand, is right up in here. Right in this little pinky, well, on him it's pink, area here. And if you poke it with an iliopsoas, your dog will scream if it's reactive. So basically, you're just going to take this and just stretch, 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 stretch. And effectively what happens is, think of it like butter when you take it out of the fridge. When you take it out, it's hard and you put your hand on it, it's like it's got no give to it. But the more you have your hand on there, it kind of melts the butter and you can kind of get in there and move it around. Oh, he says, I think I like this. You can also take, and this is again for the groin, is just using this part of the side of your thumb and just rubbing down this way. There's a muscle that comes up here and attaches up in here, but it's sort of right beside where part of the iliopsoas complex comes in, and it can be quite reactive, called the sartorius muscle, I find anyway. And like right now I'm palpating this, and if your dog had an iliopsoas, he would probably not like it too much. So hence why you use your thumb and just very gently. Now the pressure you're going to put on is, going back to the pie crust, is it's the pressure you would use if you were making a pie crust or a pizza. If you go too hard, you're going to go through the dough. So the same holds through with you doing it on your dog. This is especially good for older dogs. They start to get very dehydrated fascia. So that is how you can do myofascial release